I felt like I didn't go to medical school to be a secretary. It would take about 10 or 15 minutes to talk to the patient. The documentation after that could take upwards of 20, 25, 30 minutes. And 15 minutes are only focused on the patient. And a lot of times you're rushing the conversation because you know you have so much work to do afterwards. They can't imagine their life without ambient speech anymore. The latest data that I saw, it was saving hospitalists 1 to 2 hours a day. I think ambient speech technology is just a hit. It's going to catch on. Everyone's going to be using it in a few years all across the board in every care setting. At the core of all of this, the reason that all of us got into healthcare is for the patient.
Hello and welcome to Private Practice Secrets. I'm here today with Vikesh Tahiliani. He is one of the most important people actually in healthcare transformation. Vikesh, hello and welcome.
Thank you for having me.
Of course. Vikesh is board certified in internal medicine and clinical informatics. He's been at HCA for the past 14 years, both at the division level and at the corporate level. And for the past 3.5 years, he's been the VP of Digital Transformation and Innovation at HCA. He's currently building his own startup as well on clinical documentation. So he is an incredible resource on all things Ambient AI, on documentation, on clinical transformation within hospital systems. He has enabled us to basically deploy one of the biggest AI deployments in healthcare, and we've partnered with him on this. So Vikesh, thanks for joining. Your expertise in both clinical transformation, in documentation, and overall, really building up healthcare is so valuable. I would love to have you intro and just get to know you further for our audience.
Yeah, happy to. Welcome. Thanks all for having me. So my background is I grew up in the Kansas City area, went to college in Virginia. From there, went to medical school at St. George's, did my residency in internal medicine at the University of Kansas. And then I started working at UMDNJ, which is a hospital system in New Jersey, which is now Rutgers. And it was after that, so about 2009, that I joined the HCA family as a division hospitalist director in the Mid-America division. So as you guys know, HCA has 16 divisions. One of their divisions, which in those days was Kansas, Missouri, Louisiana, and Mississippi. I led the hospitalist program there. Took a couple years break to work for Cerner, which is now Oracle, to get some implementation experience. And then following that was the Chief Medical Information Officer back with HCA at the Mid-America division, then transitioned to the corporate office, did informatics for a few more years. But the last 3.5, 4 years have probably been the most exciting, where I've been focused on innovation and specifically innovation with clinical documentation. And as you mentioned, a lot of work with the ambient technology that Commure has.
So what do you think are the biggest pain points that you've experienced while you were practicing, as well as, pain points that you've seen while working with thousands of providers across the board? Really
good question. The biggest pain point for me and some of my closest friends that are hospitalists as well is honestly documentation. And when I talk about documentation, I'm talking about 10, 15 years ago. If you saw a patient for the first time, and you did what we call an H&P, a history and physical, it would take about 10 or 15 minutes to talk to the patient. But the administrative work after that, the documentation after that could take upwards of 20, 25, 30 minutes, depending on how complicated the patient was. And that really takes time out of the day. If you're spending 45 minutes on a patient and 15 minutes are only focused on the patient, and a lot of times you're rushing the conversation because you have so much work to do afterwards. And so that used to be really annoying. I felt like I didn't go to medical school to be a secretary. And unfortunately, that's just the way it was until some of these new technologies came about.
And during your time at HCA, what was your experience around Ambient AI when we were deploying, or even your introduction to Ambient AI and across the board during deployment, when you first tried it, when you saw providers try it? What was the sentiment and overall experience?
So I think in general, there was a lot of excitement around it because I think most of our physicians saw the end vision. When we first started, it was very early on, and we had to have humans in the loop, making sure that the machines were creating the right type of notes. The quality of the notes was not necessarily ideal. We really had a tough time initially with integrations. But I will say that over 2 to 3 years, we overcame those obstacles. And now the sentiment, I would say, for the most part, is very, very good. Everyone's excited about it. When I was at HCA, the latest data that I saw, it was saving hospitalists 1 to 2 hours a day. Outpatient docs were saving a ton of pajama time. So, for those of you that don't know what we label as pajama time, it's when physicians leave their shift, leave the hospital, leave their clinic, they go home, do whatever they have to do, and then late at night when the kids are in bed, they're writing their notes. Giving those providers that time back, I think, really resonated with them. Was really appreciated by them. And the thing is that it was sustainable. This wasn't just hey, the technology works on certain times, certain days. It just works. Period.
Thinking about HCA is a massive hospital system. There are hundreds of hospitals, thousands of physicians across the board. When it came to the time to actually implement the solution, I know when we were chatting the other day, you mentioned that was one of the biggest questions that people asked you, whether it's their private practice or if it's the hospital system, like how do you deploy? How do you deploy to, let alone tens and hundreds, thousands of providers? What was like your deployment mechanism implementation overall for Ambient AI?
I'd like to preface this by saying that HCA is obviously an enormous organization, but foundationally they're built really well. And some of the things that HCA did that worked so well was that they had an excellent education team. They had an excellent change management team. Mm-hmm. They had an excellent communication team. And when it came to deploying this technology out, an excellent implementation team. So we had, I say we, I'm no longer with HCA, but they had right-sized teams to address all of these bodies of work, which when talking to some other healthcare institutions or systems, they just don't have these teams. Mm-hmm. And they're just like, we'll deploy it and hope it works. But at HCA, they made a dedicated effort in all four of those areas.
And when you think about like anyone watching, whether they're in charge of a hospital system or a clinic, in the case that they don't have teams that really like has infrastructure as HCA had, what are your like biggest recommendations overall to ensure that they can also implement such a solution across the board for their providers?
So that's a great question. I was recently at a conference less than a couple of weeks ago, and I was talking to a couple of healthcare system leaders. Mm-hmm. And they had told me that their adoption with ambient speech technology was less than 30%, and they were happy with that. Which caught me by surprise. Number one, how can you be happy with that if it's only at 30% and you're making the investment in the technology? But it also speaks to what happens when you don't have these teams that are focused in these specific niche areas. Another thing that really helped us with the implementation when I was at HCA was the fact that Commure provided forward deployed engineers on site at the time of deployment. I'll give you one example that sticks vividly in my head. I was with one of the Commure engineers, and we were rounding with a physician at one of HCA's facilities in Dallas. And this was early on. The physician went into the room, had the conversation with the patient, came back out, told the Commure engineer after they saw what note had been produced, there are these 5 or 6 things that I really like about the note, but there's these 2 or 3 things that are just not right. And that physician went about editing the documentation. When he went into the next room, the Commure engineer got on his computer and was coding, doing whatever they were doing. But by the time that physician came back from the second patient's room, any error or any tweak that he wanted to be made was made. And the physician, I remember his face. He's like, "You did that when I was in the patient's room?" And the Commure engineer was like, "Yeah, that's what we do." Which, once again, was not a one-time thing. I saw this over and over and over again. And I would recommend any healthcare system out there, if you are going to deploy ambient, whether it's with Commure or someone else, make sure that they have engineers and implementation support on site.
Yeah. And I think that's an incredibly good point, because it's like every physician likes their own note, the way that they write it, right? And so in order to make it perfect for them, it's really hard to get it out of the box. And so you have to significantly customize their templates. We sometimes have to even build solutions, right, within the product, because the hospital system just uses it a little bit differently. And so, having forward deployed engineers to just go on site, side by side, work with the providers. You said you remember vividly. I also remember vividly a photo we have, which I'll put it on this video as well. But there's all of our engineers and all of our implementation folks and our ops folks just be on site to be like, sitting down with their laptops, like side by side with the providers, to really ensure like every single mile is completed, every preference is completed, because it goes back to your point of adoption rates. Because if you can get it right, the provider ends up using it. If you can't get it right, provider does not end up using it. It's not kind of a gray area where it's like they use it sometimes. It's like they either love it or it's just not right for them, which is why they don't use it, right? Exactly. And so working with HCA was wonderful because there was so much help, support, and overall across the board, there was like, hey, we'll make it work. Like, let's just work together hand to hand. And then for anyone who might not even have that kind of a support coming from the health system, Commure absolutely goes in to ensure that, implementation is on the ground and operations, the team I lead on the operations side, we're on call. We're like ensuring that providers, even before they get onboarded, all of their preferences are already in the tool and just set up for the providers out of the box.
That was a really big win, for the providers in terms of the fact that Commure gives them the ability to make very complex customizations if they choose, or very simple customizations if they choose. And one of the ones that was a big hit was that when a note is created, the provider can say, use a standard length, make it more detailed, or make it more concise. Some physicians like to write half-page notes and that's it. Some people want 3-page notes. Commure's technology just allows you to do and write the way you would normally write.
Yeah, absolutely. And so, of course, there are challenges that come with such a massive deployment. What do you think are some challenges that you had to deal with, that you had to overcome, and you would also suspect that other people might have and strategies that they could use to overcome this?
So surprisingly, the challenges were somewhat limited, and it was focused around one key piece. You're always going to have those individuals that are just resistant to change. That's why our change management team was so integral to the conversation. But you do have the providers that have practiced the same way for 15, 20, 25 years. And they're like, I already do a good job. I do not need help. And for that, we kind of rely on their peers that have adopted the technology to communicate to them that, hey, I just saved an hour and a half today. I'm done with all my notes. And then, over time, there'll be that change. It just sometimes takes a minute for some individuals.
And on that note, when a provider is either resistant to a change or they're just having a hard time maybe getting onboarded or have issues using any sort of a product and they see their peers doing it, what are some things that you've realized as an output of using an Ambient AI solution? You mentioned documentation times. Did you see a difference between someone that used the product versus did not use the product, or whether, how was this overall going to the kind of end of the funnel into RCM and close times and just overall RCM processes?
Yeah, this would be a spectacular question if we were a year down the road, because we were getting so close to getting some of this data. But some of the things that we did see, and we saw it really early on, is that number one, the notes were more accurate. And what I mean by that is if you're seeing a patient that's here for a pneumonia, 9 out of 10 times the doctor is focused on the pneumonia, but the patient may also report that they are having some other symptom. Well, guess what? When you're focused on the patient and the technology is listening to the conversation, it captures all relevant pieces of information. And I think that is truly helpful, because when the doctor then goes behind the computer and they're editing their note, they're like, oh yeah, the patient did say that their left hip has been hurting for a while. Let me get that left hip x-ray. Whereas, when they're going from room to room to room to room, they may forget that patient with the pneumonia had complained of left hip pain as well. So we saw a lot of that, which I think at the end of the day, if you had to talk to me 6 months, a year from now, my guess would be that there would be an increase in patient satisfaction scores. My guess, and this is an educated guess, would be that physicians receive decreased amount of queries. So queries are questions that the patients get from the billing and coding teams after the patient is discharged, or even while the patient's in the hospital, about, hey, you said anemia. What type of anemia was it? Or you said the patient had heart failure. What type of heart failure? Well, with the technology capturing more accurate information, those number of annoying queries should reduce.
Awesome. And one of the very crucial metrics that both HCA looked at, or we looked at as well, is the success criteria. What makes this a successful deployment? From an Ambient AI perspective, what are your key metrics to success? How do you measure successful deployment?
So we've gotten asked this by a lot of other healthcare systems. So in no particular order, one of the items is the F1 score. So that measures precision and recall of the note. So when the conversation is had, how accurately is that information captured, how precisely, and how much of that relevant information is put into the final note that the physician has to edit and sign. Don't quote me on this. I believe the industry standard is somewhere around 0.7. It's a scale from 0.0 to 1.0. Commure's technology, and once again, this is as of just several weeks ago, was really between 0.8 and 0.9. So far above the industry standard. So that was one metric we looked at. Documentation, time savings, we've already talked about. I would loop in there pajama time savings. So a lot of times, the physician is telling us that, hey, I'm still leaving work at the same time, but now they don't have that extra hour at night that they're working in their pajamas. We started measuring a bunch of other metrics, such as reduction in coding queries, reduction in CDI queries, financial impact. Still a little bit too early to measure that. We measured adoption. So at the time that I was at HCA, there was not quote unquote mandate to use it, but our adoption levels all across the board, inpatient, outpatient, and ambulatory care setting were really high. If I'm remembering correctly, on the outpatient side, it was north of 80%. On the ED side, it was north of 80%. On the hospitalist side, I believe it was well over 60%. So really high adoption without mandating it. And that kind of goes to that saying, like, if you build it, they will come. If the solution's good enough, people will use it. And this was a great solution. I mean, when I hear the numbers 80%, it just blows my mind away.
And comparing that to people that you've heard in the industry where they're like, 30%. Yeah.
Exactly.
Yeah. And just speaking from an operator perspective. So it's lovely to see a healthcare leader and a, operator just being able to work on this together and talk about this. But what we do as well is just to ensure that one thing that keeps us up at night is adoption, literally. Yeah. And so it's how do we get this number higher? What is the best we can do? Let alone that when we reach that, what is better now that we can do from this? And so this is based on customization. This is based on provider communications. There's moments where we give our phone numbers to providers and be like, please just call us. We want you to love this product. Whatever we can do, we'll make sure we do it right away. What we try to do in that aspect is, as soon as we get a feedback from a provider, we turn around in 4 hours. Anything that we could do into customization, we just have a 4-hour turnaround time within our operations team, where, unless of course it's engineering related, where there's a bug reported or something, if it's any preferences, we get it out right away. And that we see overall just ensures that provider is able to continuously use the product rather than waiting for days or months for something to be fixed, right? What are some kind of feedback you've heard across the board after this deployment?
I could honestly speak half an hour nonstop about this. But the short version is I've heard from practicing physicians that they don't want this tool ever to be taken away from them. They can't imagine their life without ambient speech anymore. I've heard from hospital leadership that their physicians are ridiculously happy with the technology. We have heard from physicians that don't have it yet that they want it, and they want a timeline of when they're going to get it. So just crazy amounts of enthusiasm. Every once in a while you come across items that are life-changing, and I'm going to exaggerate a little bit, but not much. I mean, when the iPhone came out or smartphones came out, they were a hit, right? They just were a hit. I think ambient speech technology is just a hit. It's going to catch on. Everyone's going to be using it in a few years all across the board in every care setting.
And when you, given your experience both with Commure and overall in the clinical care and digital transformation, why do you think HCA decided to go with Commure?
That's a fair question, and we get this asked all the time at conferences. So just to be transparent, the decision was made before I joined the digital transformation and innovation team by some of HCA's leadership, but I understand the rationale, and I agree with the rationale that the decision was made to partner with Commure. Number one, you want great technology with a great foundation, which Commure had. You wanted to be up to date and be the latest, which Commure had. You wanted to be aligned with the vision, and I think HCA and Commure's vision were aligned. But I think equally as important as all of those three, we were looking for a company that was willing to co-develop with us. As you know, technology evolves very quickly. And so when my leaders had looked at some of the other technologies, a lot of companies had a decent out-of-the-box product. Mm-hmm. But Commure was willing to partner with us and say, you know what? Not only do we have a decent out-of-the-box product, but we are going to make it great for you at HCA. We can speak later about the conversations. But I mean, HCA and the Commure team talk on a daily basis every single day. I mean, that's how closely they work together. And Commure truly had delivered, I shouldn't say had, still is delivering product that is the way HCA wants it in their environment.
Wow, that is, I'm glad we're hearing those words from you. And in that kind of aspect, given that there was a big partnership involved in building the product that HCA exactly wanted, what do you think has been the most impactful care setting that you've seen Ambient AI really, really work and help providers out in?
I would say that in the ambulatory care setting, there are many companies that are doing reasonably well in the space. When HCAs first started using ambient speech technology, the decision was made to use it on the ED first. Mm-hmm. And the reason is that is the most complicated care setting. You have bells and whistles and noise and patients in hallways and all sorts of commotion going on. And the thought process was, if we could get this right in the ED, we can get this right anywhere. Mm-hmm. And lo and behold, now we have it deployed in all three care settings, and we have HCA has it deployed really well.
Now, after getting a really good deep dive from you in terms of ambient AI, what do you think is next on the horizon for overall physicians, for care settings, for overall clinical transformation?
That's, I mean, my mind is going all over the place. When I think simply from a physician's workflow perspective, documentation and placing orders kind of go hand in hand. So I think very soon around the corner, there are going to be solutions out there that are going to tee up orders based on what the ambient AI creates documentation wise. So if you're seeing a patient that has chest pain and you're leaning towards this patient having a myocardial infarction or a pneumonia or whatever condition, suggested orders will pop up. Mm-hmm. And then the physician will just select the appropriate orders and click sign, rather than going through a lookup and saying, okay, I need this type of order or this type of order set. They'll just be face up for the provider to either approve or not approve. That's just where my mind is going. On the back end, I think autonomous coding is going to be really big. If we're generating the documentation, we're making the physicians' lives easier by just being able to edit and sign that documentation. Why can't we on the back end help the billers, coders, abstractors, our RCM teams with some of their workflows, so the entire end-to-end piece is in harmony, mm-hmm. and we're saving everyone time, and probably more importantly, we're doing the patient good by doing all of this accurately. Would
you have any kind of last words or any recommendations or any kind of other metrics or important parts of ambient AI deployment that you would kind of want to mention?
I think the most important thing that I would say is, when you think of this, if you're a healthcare system out there that's thinking of deploying these tools, where our brains naturally go is, what are we going to do to help the doctors? What are we going to do in terms of revenue generation? But at the core of all of this, the reason that all of us got into healthcare is for the patient. So think of everything from the patient's perspective. When they read their note in their patient portal and they now have a more accurate note, that's a big win. When their insurance pays the bill because the documentation is accurate, the patient wins, and then we all win. So just focus around the patient first. The other stuff will take care of itself. And I think if you take that patient-centric approach, number one, you avoid getting into trouble, but number two, you're just doing the right thing.
Wonderful. Vikesh, thank you so much for being
Thanks
with us.
Thanks again for having me on.
I'm sure this will really contribute overall, give confidence to people in ambient AI deployment, as well as what kind of metrics we look at. How does a big hospital system deployment look like from such an important person like yourself? So thank you so much.
Thank you for the humbling words.
Of course. Thanks for watching. We will see you on the next episode.